Evening, everyone. I'll let a few people join and get started in just a minute. It says there's quite a few of you available. So I'll do a brief introduction. My name's Chloe, and I'm actually part of your marketing team. So some of you who actually get in touch regularly with us will have probably spoken to me a few times. So it's actually nice to put a face to a name, I reckon, for some of you. So welcome to the egg donation event this evening. I'll do a little bit of a brief run through of how the event's going to work this evening, and then how long we're going to be on for. I think it's about 30 to 35 minutes. And as always, please submit any questions or any comments that you've got, and I will do my best to keep an eye on them this evening for Lisa and Julie, who are going to be joining me in just a second. So I'm live from the Manchester clinic where we're all based for the event this evening. A couple of questions are coming in already. I'll make a note of those, and I'm just going to get Lisa and Julie to join me. I'm going to invite them on, but we're going to start with a general chat, a little bit about the donation journey itself, and then a little bit about the essential information that you guys need to know. And then we'll do a bit of a Q&A. So during that section, please submit any questions that you've got as well, and then we'll do our best to answer them as best as possible. And then we are going to be joined by a special guest this evening, one of our patients from our Nottingham clinic, Luke, who has had experience with our egg bank and had treatment. So it would be nice to sort of bring things full circle for everybody and sort of have a little bit of info from a real patient. So I'm going to invite Lisa and Julie on just now. Hopefully, I'm quite good with the tech now, and it wouldn't take with me. I'm hoping that's gone through. Hello! There we go. He's all right. Can everybody hear us? Is everything okay sound-wise?
Yep, can hear you.
Beautiful. If anyone can just give us like a love heart or anything like that, or any comments just to say if the sound's right, or if anything pops off, just let us know throughout, because we are quite conscious of it, aren't we? We want to make sure it's perfect. So do you guys want to introduce yourselves? I have done a little bit. I said you were Lisa and Julie from Manchester, but do you want to take over?
Yeah. So my name's Lisa Richardson. I manage the donation service within our Manchester clinic. I also help support the donation teams across the group, across all of our clinics.
I'm Julie. I'm a donation nurse, so I work with all our lovely donors and our recipients. I'm based in the Manchester clinic and part of our dedicated donor support team as well.
Lovely. Oh, we're all Manchester, aren't we? So it's nice up north. But yeah, we've got clinics all across the UK, and as Lisa mentioned, she does help to support all of them and all our lovely donation teams. So if you are thinking of donating, you can actually get in touch with our dedicated donation team. So if you've got any questions, the inbox is open and we'll do our best to answer them. We've also got the phone number. So if you wanted to call the team tomorrow and actually speak to one of the team, that number is 0808 178 2860, and it is available on the website as well. So I feel a little less nervous now. I think we could kick off. I'm going to kick off with the start of the agenda. So it's, why do we need donor eggs, and who needs donor eggs?
Okay, so we've got lots of different types of egg recipients. It may be that a lady needs to use donor eggs due to a medical condition, or it could be her age. So as us ladies get older, unfortunately, our fertility success rates go down, so it may be that they need donor eggs for that. It could be that we have two male couple, and they need to use surrogacy and donor eggs to be able to start their family. Be that somebody's tried many times with their own eggs and it's just never ever worked for them. Ladies that have had early menopause, or unfortunately had cancer and had to have treatment and things. So lots of different types of people that need to use.
Yeah, perfect. So that sort of gives us an overview of what kind of patients that we see and different circumstances. And that's obviously why we have egg donation, because it's sometimes the only option for people, isn't it?
It is.
Yeah. So as a donor, you're going to be potentially changing lives of people. So it is an amazing, amazing thing to do. And I know that will probably say that 1,000 times throughout the event, but it is just to reiterate how important, how nice it is.
Yes.
Yeah. Okay, so if someone then is thinking of becoming an egg donor, how would they get started?
So firstly, I'd just like to say thank you, because like Chloe just said then, it is a lovely thing to come and do. So we always like to make sure that it is appreciated and just how much of a wonderful thing it is, and thank you. So if you are considering it, it's lovely of you, thanks. The easiest thing to do is just to go to our website and register your interest, and then you'll be sent the relevant forms for you to fill in. It's the easiest and quickest way to show your interest, really.
Brilliant. Oh, sorry, phone just slides off a little bit there. It's resting on something, that's why. Sorry.
What I would say, I know you're going to probably ask me in a second, Chloe, if you are considering egg donation, just a few things before you go off and fill those forms in terms of criteria. So you do have to be 18 and above, and not be past 35. You do have to have a BMI of 30, under 35. Not be pregnant yourself. You need to make sure at least 6 months has gone by after birth of baby, and not be breastfeeding and have had your period.
Sorry.
When you're considering egg donation.
Yeah, we do get asked that quite a lot. So that's a really good one to cover. A lot of people say, I've just had a baby of my own, I do want to do egg donation, which is obviously amazing, but they would need to know kind of what, I guess, I want to say returning back to normal, but I don't really like that word. But yeah, getting back to
everything settle down.
Yeah, basically. And if they can or can't be breastfeeding, that's obviously a massive one, isn't it? So
yes.
That's good to cover. And yeah, my next point was the criteria, which you have touched upon. So I know you've mentioned things like age, not being pregnant. Is there anything in particular that might exclude somebody that you think is worth noting, or do you always think it's best to fill out the form and then we can do it on a case-by-case basis?
It's best to do it on a case-by-case basis. The only thing just to point out is contraception. So we can accept people on most forms of contraception, but if you're using the depot injection, for example, you would have to have stopped that and have had like 2 or 3 consecutive periods. Same if you're on the implant and don't have periods, you'd need to perhaps look at getting that removed and having those periods returned, because it works. So bear those in mind, but your main ones are make sure your BMI is within,
I'm having a nightmare with this.
Make sure you
sorry. I'm trying to type the questions as they come in, so I've got them written down, because I'm just scrolling through. We've had some come in, I'm just trying to type them so I don't forget them, and then I keep knocking my phone back. Sorry. Okay. Perfect. So the criteria is covered. So I think the next one to lead on to that would be sort of like the laws then around donation. That changed at some point. It used to be anonymous quite a while ago now, though. But yeah, just sort of the laws surrounding donation. On those.
There's no anonymity. I'm impressed I said that tonight.
Yeah.
Yeah,
it's any child born as a result of donation, whether it's egg, sperm, embryo donation, has the legal right, once they reach the age of 18, to find out who their donor was. They can contact the HFEA directly for that. They can find out name, place of birth, date of birth, and last known address. Okay, that is their legal right, which is explained to donors, at all stages of their appointments, to make sure that they are comfortable with that, because there's no opt-out option. That's the law, that's what we have to follow. So you can't kind of go and say, well, I don't want that to happen, because there's no choice really. That's what it is.
Yeah, so I think it is really important that people know that, Care are really good at supporting and obviously talking to potential donors about all these things. Counselling is available as well, which is again really important to mention. So just that donors are fully supported, as well as recips. Look after both as much as we can. So it's just to know that you can answer all your questions in a safe space, and there's nothing that will hide from you, really. It is all very open, isn't it?
Yeah. We expect open and candid conversations, and for our donors to be open with us about all their medical history and things like that, just as we will be with them, in terms of making sure that they're fully informed, so they can make their own informed decision as to whether donation is right for them.
Yeah, we do have a designated donor support So that is a team of experienced donation nurses, consultants, administrators, healthcare assistants that just deal with our donors. So Julie works part of her hours on the central team looking after our donors, and then the other half of her week works with egg recipients. So we do see each different side of it.
Yeah.
Obviously, so you understand from the donor's point of view what they're going through, and you understand from the recipient's point of view as well what their experience is. So it's a good all-round process, really. We deal with.
Yeah, for sure. And sort of one of the aims of this event is to bring donors and recipients kind of full circle, as I mentioned before, so donors can know the journey and things like that, but then the recipients can also see it as well and see how the screening process is, and then hopefully when Luke joins us in a little bit as well, donors can see the impact that they have on patients.
Yeah,
from donating.
Don't see it's all anonymous to the point of the child team, so that's why I'm always like, thank you so much, it's amazing, because our recips who are using donated eggs can't do it themselves. So
in betweeny person that thanks the donors, support is the recips, because they can't physically meet each other. So our job's to kind of bring the two together and support them both.
Yeah. And I know we're not touching upon it this evening, but it's kind of like just to show the difference between egg donation and surrogacy, whereas surrogacy, the person's actually going to be well involved. If it's someone, it's not a family member or someone that you've chosen. If you are going out there to seek a surrogate, they are obviously emotionally involved and all that, and part of a massive journey. So there is that difference, but it is nice that there's still, we try and like almost link things emotionally still as well, don't we? If that makes sense. We want the donors to know the recips are looked after and vice versa. So it is nice.
Donors, I've met lots and lots of donors, and they all genuinely want to do it for the right reasons. They've had, they may have family or friends that struggle to conceive themselves, so they can see the emotional impact it has on people that struggle to conceive, and they genuinely do it for the right reason, and they're really keen to know if their donations have been successful and things like that. So
yeah, definitely. There are a couple of questions coming in, and I thought this last question that I've just seen, we are going to touch upon it in the Q&A, about known donation. We have got that down, so we will touch upon that as well. If there are any medical questions, guys, that come in and we can't exactly answer them right now, we will get one of our medical experts' opinion on it, and we will get back to you personally. So just make sure that you sort of DM us afterwards, just to remind us, because these comments do get lost afterwards. So it's just a reminder, send us a DM and I'll get a medical back-in answer for you if you need it. So I guess the next part of the live this evening is talking about the donation pathway. So what does that sort of involve? So once I'm onboarded, for example, what happens to me?
So once you've registered your interest on our website, we will send you some forms for you to complete. So clinical questionnaire about your own medical history, the types of contraception you're on if you've had your own children, and also about your family history. And what I would say, guys, is if you are completing those forms, just be as open and honest as you possibly can, and give us as much information as you can to make the assessment of that form easier and quicker for us. So your forms will be assessed, and it may be that if I'm assessing those forms I need more information, so I might drop you an email for further information, and then those to one of our consultants, who will ultimately then decide, based on all the history that you've given, whether you're suitable to donate.
I was just going to ask, sorry, just before you move on, it was just about forms initially that you fill out. So if I was to submit them, is it a couple of weeks wait while they are assessed and then you'll get back in touch? What kind of time frame is that? We do get asked that quite a lot.
Yeah, allow a couple of weeks, because one of the nursing team or the admin staff or healthcare assistants will review those forms, and it may be that we need to for more information and then update your forms and then get one of our consultants. So yeah, I'll allow for a couple of weeks. As soon as that's been signed off by a consultant, then it's a case of we'll get in touch with you to say yes, you're suitable to donate, and we'll look at booking you in a telephone appointment with one of the donation nurses or midwives. Amazing.
Perfect. Sorry to that, but I thought that we do get that quite a lot. Right, I've sent my forms off. When am I going to hear from someone? Just to sort of give a timescale.
Yeah, and then they'll get to speak to one of the donation nurses initially, because it's a real it's a really big thing to do, to donate your eggs. So we arrange a telephone call so that it's an opportunity really to find out initially what the process involves and to ask any questions that you might have. We get loads of little questions about, well, do I need to do injections? How long does the process take? That's to ask all those questions that you might in thoughts that you think, I just want to ask that before I go any further.
What involve? Are there any side effects with the injections and things? So it's about
back on.
Sorry about sure who couldn't see you there, Chloe.
Don't worry, I've just been talking to myself probably for about a couple of minutes, thinking I was still live. I could still see myself and hear myself. You guys were just spinning, so I thought, right, let's just end it and let everyone rejoin. And we'll do it as part 2, so we won't lose the videos. I'll combine them, we'll post them again so you won't miss anything. Any questions anyone's submitted, please submit them again and I'll catch them. I think I got them all. And then we're going to do the Q&A very shortly because time is flying. Actually, it's 10 to 7, and we want to obviously let Luke join us before the end of the night. So I think we touched upon the donation pathway. I think we've gone into just doing the forms. So what would then be the next step?
So
once you've completed the forms.
That phone call with one of the donation nurses or midwives. It's about a 45-minute phone call to talk, just go through the process of what's involved, ask any questions that you want. If you feel that you are happy to proceed, we then look at booking you in for a blood test to look at one of your hormone levels, a scan, it's an internal transvaginal ultrasound to assess your ovaries. If that's all okay, it's another appointment then with one of the donation nurses or midwives again, either via Starleaf or face-to-face in the clinic. Again, just to talk you through everything because it's a lot to take in one appointment. Counselling, as you mentioned before, implications counselling if you want it. It's a telephone call, and then a final kind of blood test to do some genetic and viral screening.
Brilliant.
Is that okay?
Cool. Yeah. So with our donors, when we get them through, do they write a little bit about themselves? What do we sort of put out to our recips?
So initially, during the initial call, we'll take physical details like eye colour, hair colour, because everybody usually wants to try and match with somebody that physically resembles them in some way to start with. And then it's my favourite part of the job, and I say it every time, our donors can complete a donor information form where they can write some lovely information about themselves, their interests, their hobbies, their reason for donating. There's a little area where they can write a message of goodwill to any future children born as a result of their donation. And just a personal description of them, their interests, their own family likes, favourite food. That's always on there. We always read favourite food.
Oh, that's good.
It's a blank page.
You can write anything.
So the donors always complete the characteristics. That's something that they have to complete. Their weight, their eye colour, hair colour, and then there's a part where they can fill in about themselves. Now the blank page, if you like. Some donors write lots and lots of information about themselves, about their hobbies, about education, all about themselves. And some just like to write a couple of lines of why they're donating, a little spell about themselves. And every donor is different about what information that they want.
And that's available to the person considering using those eggs to read, to help them with the decision.
Yeah, that's really nice actually. So you can kind of get a match on a more personal level as opposed to just, oh, they look like me. There is a lot more to it. And yeah, we want to know about the donors, and I think it's really important to the recipients that, again, your donors doing it for the right reasons, and they 100% always are. Yeah, I
would say in my experience, for 2 years, donors that I've worked with and we've got to egg collection are 100% are doing it for the right reason, for sure.
Yeah, and they are all amazing. I said we were going to say it loads of times anyway, but they are, and they do need to know what an amazing thing they are doing. And we're speaking as staff members, but also on behalf of recips, because we see how happy, which is lovely. Is there anything else that you think's really important to sort of mention that you might have made notes on as we've been chatting? Because I know it's a big thing, lots of details. So if there's anything that you feel like we need to mention before we go into the Q&A, and anyone that has kindly rejoined us when we lost connection, please put any questions in and we'll answer as much as we can. And then we're going to bring Luke, our patient, on.
The only I always say to people when I'm talking to them during their appointments is that whilst the kind of act of donating your eggs does involve medical procedures, blood test scans, the actual egg collection, you know, it's quite clinical, the act of donating has lifelong implications. So as we said before, you know, donor conceived children can find out who their donor was. So potentially, you know, 18, 19 years down the line, that person may want to make contact. So medical procedures are involved, but it does have those lifelong emotional implications. So it's not just a one-off, oh, I've donated my eggs and, you know, off you pop.
Yeah.
Forget about it. It can have lifelong implications. So
yeah, it's just to be mindful of that, really. But again, we do fully offer counselling for those things, and we talk you through it and put it into sort of layman's terms and more relatable way for you and moving on into the future. Lovely, brilliant. So what I'll do then is I will go into the questions. We've had quite a few, so again, we'll cover as much as we can. Please type any in and I'll catch them, and then we'll bring Luke on. So first question is there a geographical distance limit required between an egg recipient and a donor?
Okay, so we have 13 main care clinics. We also have 10 satellite clinics. So we have donors that donate within each of those clinics. The vast majority do donate to the frozen egg bank.
Yeah.
Then our egg recipients match themselves via the egg bank. So it may be that you choose a donor. You won't find out at which clinic, though, the donor did donate at.
Mm-hmm.
It could be that you pick a donor that donated in Manchester, for example, and you live in Manchester. It could also be that you choose a donor that donated in Liverpool. So we don't kind of look at the geography of it. Although if, for example, you was donating your eggs and you knew that, I don't know, say somebody on your street was using donated eggs at this clinic, the donor can specify that they don't want anybody who, you know, who lives on their street or anyone that lives, you know, it might be that somebody you know, for example, is using the bank, so you could specify that you don't want your eggs to go to them.
Yeah, lovely. Brilliant. I've just noticed, I just want to acknowledge a question that has come in. It is more of a medical question. It's asking, I think, about sperm morphology. I will submit that to one of our doctors and I'll get back to you personally after the event tomorrow. So I just wanted to let you know that we're not dismissing your question. It's just that we can't answer it this evening. So I'll do that. So leading on to that then, let's talk about a little bit about known donation then. So I think somebody asked, what happens if I was to choose a donor that I know?
Yeah, you can be a known donor for somebody. If you're wanting to use a known donor, contact the clinic. Again, the easiest thing is via the online website, and then we would ask your donor that you're considering using to then contact us. We can't go them on your behalf because we need to make sure that each other are happy for us to speak to each other, so we're not breaking any confidentiality. So if you've got a donor that you want to use that they're happy to, just ask them to contact us. There's certain familial links that we have to be mindful of, so you can't be, you know, I couldn't be an egg donor for my brother because we can't have sibling egg and sperm mixing.
Too close genetically.
But I could donate to my sister and it'd be my brother-in-law because we're not related. So you just have to be careful of that.
Yeah, there's a science behind it.
Yes, there is. So you have to be mindful of that. But yes, we do known donation.
Yeah, we do.
Fabulous. So yeah, anyone that's sort of thinking about, or if you have got a known donor, that's the way to do it. So hopefully that's answered it. Hopefully that will explain it for you fully. But if you need any more information, just ask away. Or again, we've got the donation team available by phone, or contact your local clinic. So is there then, this is more maybe for recips. So we are touching upon recips and egg donors this evening. Is there a waiting list for the egg bank?
No.
Wonderful.
Yeah, we've worked really hard at having no waiting list, and we currently are able to offer our egg recipients to choose their donor eggs as soon as they're ready for treatment. So once they've had a consultation and they spoke with the donation team and they've got everything in place to have treatment, they're given access to the frozen egg bank. and they can choose their eggs. Most people then start treatment within about 4 to 6 weeks usually, sometimes a little bit longer, because the eggs are stored at the clinic that they was donated, and then they're moved to where the egg recipient is having treatment. So it's quite a quick process really, because we don't have a waiting list.
Amazing. That's really good. I'm conscious. It's just so easy to just get chatting and everything, isn't it? And I was like, oh, we're going to be on for half an hour. It's nearly 7 o'clock and we've still got to get Luke on. I'm going to speed through these questions as well. But obviously your answers are really detailed and exactly what people need. So can I find out about any children born from my donation?
Yeah,
I think you
can.
did that before, didn't you?
Yeah, so I give it a good 12 months after your egg collection to allow treatment and a pregnancy to have occurred. We don't routinely give the information out. You do have to ask for it, but we can tell you sex of baby and year of birth.
Fabulous. Oh, that's really good. That's quite sweet. Can I donate to a person I know? Yeah, I've got that. Are there any backgrounds or ethnicities that we struggle to recruit for? I think this is quite an important one.
There
Definitely.
is, yeah.
I would say 95% of our donors across all clinics are white. So we do really need donors from, Black and ethnic minority backgrounds, because we have recipients from all kind of ethnic backgrounds that need to use donor eggs. So yeah, 95% I would say are white. So yes, we desperately do need donors from other ethnic backgrounds. Yeah.
Yeah.
Anybody. And answer any questions that may have prevented people coming forward in the past. So yeah.
Yeah. Just had a question come in, just touching back on known donors. So if you're a known donor, their eggs don't go to other people. It's just a known donation to that couple.
And the consent form will clearly state that. So
yeah. Be exclusive to your egg recipient that you're doing it for. Yeah.
Fabulous. I'm 45. Would donation be the best option for me?
Probably.
I know it's a little bit more medical, but we tend.
Depending. I mean, it's really quite difficult without having a scan and checking hormone levels. But at 45, in the experience of fertility in our clinic, donor eggs would be the best, the highest success rate probably than using your own eggs at 45.
Yeah, it's that we can still explore options. With your own eggs, but it would be probably an egg donation conversation would be opened.
Yes.
Because it's the quality of eggs at that age, isn't it? And but the more likelihood of kind of chromosomal abnormalities and things like that.
Yeah, we just don't want the heartbreak, really, do we? Of, in the time to pregnancy, we want to try and reduce that as much as we can. So give people their own personalised success rates when they come for consult. Real, just a couple more and then we will get Luke on. Still trying to conceive, and I'm perimenopause/menopause. Is donor egg something I can still consider?
Yes, absolutely. So some of our egg recipients may have gone through the menopause already, and because we use hormones to replace the hormones that you would normally have before you've had the menopause, so it's not a problem at all that to have treatment when you have already gone through the menopause with donor eggs.
Amazing. Last one. Again, this might be, I feel, a bit more medical. It was what are the best vitamins to take, I think, for egg quality. I don't know if you guys know that one or have a conversation about that regularly.
I mean, for anybody that's wanting to get pregnant, folic acid and vitamin D are your go-to. Yeah.
There we go. I knew you would have some sort of knowledge. So I just wanted to ask it anyway, because I said that we're trying to acknowledge all questions. But I will get that off to a consultant as well for just a bit more backing and see if there's anything more that they recommend. Just one more question. How much is consult? It's £230 at our care clinics for a consultation. Lovely. So I'm hoping he's still in the mists. Do you invite Luke on to come and have a chat? Let's try and get him on. And I've sent the invites, fingers crossed he comes through. We don't have any more connectivity issues. Oh, hello.
Hi.
Hi.
Hello.
How are you?
I'm good, thank you. You?
Oh, brilliant. Yeah. Can everyone hear us all okay? Just give us a thumbs up or anything in the comments if you can. Oh, it's so good to see you. It's been such a
You
long
said
time.
that's been
So,
ages.
yeah, this is Lisa and Julie from the Manchester team.
Hi.
Do you want to do a bit of a brief introduction about you, Luke?
So I'm Luke. I've got a partner, Jacob. He's at work right now, and we use surrogacy to have a baby. And our daughter was born in November, with the help of Care Nottingham and the egg donation team there.
Fab. And Nova's amazing.
Yeah, she turns 1 next week. It's gone so far.
Yeah. Oh, I can't believe how big she's gotten now. But she is one of the 60,000. Oh,
Yeah.
can you imagine all the 60,000 in one room? I don't think it's big enough. That is literally actually a football stadium.
Wow,
That's mental to think about, isn't it? So we'll probably have you on for about 10 minutes or so, Luke. Won't take your evening too much. Probably want to get Nova to bed as well. So it's just basically to find out a little bit more about your sort of egg donation experience through like the bank and things. I know that you had surrogacy that we can touch upon in another event, but just sort of how you found the egg bank, the support team, the donation team at Nottingham, things like that. So yeah, I would say, how did you find the sort of experience with the donation team to start with in Nottingham?
The donation team were like our main point of call for at Nottingham. Like even any question we had, we'd always go to the donation team because they would always get us the answers we needed. So yeah, they were amazing, and there was never any stupid questions because like it was new for us. It was like there were so many questions, and we'd lay awake at night thinking, oh, should I ask that? Should I ask that? But nothing was a stupid question. They were always there to help.
Oh.
So yeah, they were.
That's
actually, if there's something that's niggling in the back of your mind and you're thinking, oh, I just wanted to know that, just ask it, because the chances are we've answered them before. Most people kind of questions. So although it might seem that you're being, oh, is that a bit of a silly question? It's probably not at all. You have to ask it, we answer it, and then you've not got those worries then, have you, as well?
Yeah, we were emailing like every week. There was always something I needed to know.
Yeah,
they always had the answer as well.
Yeah.
But that I think is what we want to get across is really important. Is that you can ask us that, have the comfort to ask us. We don't want you sat up at night worrying. You know, it's an emotional time anyway, trying to start a family, and we want to be your supporting family as you're going through it. Really, we really want you to feel like you can come to us for anything. So that's really lovely, and a credit again to all the teams across all our clinics. It's not just Nottingham and it's not just Manchester. You know, it's all of our clinics. The teams are amazing. So then I think that leads on to, so you've obviously gone and done the process with the donation team. They've then probably given you access to the egg bank.
Yeah.
Now, what were your initial sort of steps when you got onto the egg bank?
So we were, at the start of our treatment, we were actually going with a fresh cycle, because the egg bank, it wasn't a thing at the time. And as we were getting to being ready for treatment, the egg bank actually opened. So that's the path we chose. And they gave us access to the egg bank, and we thought it was going to be like really daunting, but it wasn't. It was so easy to use. It was great. Yeah.
Oh, good. That's really nice. And I know you said that you went with a fresh cycle. How was sort of like the matching process as well? How did you find that?
Yeah, absolutely fine. There was a lot of donors on there. There was no wait time at all as well, so that was great. And for us, the only thing we were looking for was similar characteristics to ourselves. And I know you touched on earlier saying about the egg donors, they can leave a reason why they're doing it in their notes. And ours actually said that she wanted to feel like she made a difference in the world. And that's what like egg donation does. I don't think they realise how much of a difference they actually make to people's lives. Because that lady, there's a lady out there who doesn't know us.
Yeah.
And she's changed our lives forever, and she doesn't realise how much she has.
Yeah.
I love the photos, aren't they, Luke? That was going to be one of my questions, because I kind of help our donors with what kind of information to put on those forms. I mean, is there any tips that you've got for anyone out there, for you looking at a donor and reading those forms of what?
I would just say, just be yourself. Put the reason why you want, like the lady said on ours, that she wanted to feel like she made a difference in the world, and it is stuff as simple as that. and like you can't, like, when choosing an egg donor, it's very daunting because you think, oh, are we choosing the right donor? But at the end, there is no right or wrong donor, because all the women that are doing this are so selfless.
Yeah.
So I don't think it matters which donor you actually choose,
Oh.
because they've all got an amazing, do you know what I mean? They're all, yeah, they're doing it for the right reason.
This job, you meet the most amazing people, and like I said at the start, it's my favourite part of the job, reading those forms. Some of them have me cracked up laughing, and some have me sat streaming at my desk crying because they're so emotional, quite moving.
Yeah. And it wasn't until we received that form we realised how, like, that donor was meant to be. She's like, what she wrote, I won't go into details, but it was like that she's like us, like her hobbies and things, they matched perfect. So it was like it was meant to be.
Oh,
yeah, we get a lot of people say that they just kind of they
You
know,
just know.
first look at characteristics, which
Yeah.
is important for a lot of people, but on reading that form, that they just get a connection off that.
Yeah.
And
we just knew at the time that she was the one.
yeah.
Oh, it's amazing. I'm getting goosebumps talking about this. This is a bit of the event that I just know that will really resonate with people, and this is what people will love. Obviously, the information's important, but this is even better. It brings all the emotion out, and you know, the people that are genuinely going to start going through this, like Luke and Jacob have, you know, we want them to feel reassured, and almost excited rather than nervous.
Yeah, definitely. Yeah. And I would say anyone that's thinking of donating their eggs to go on the Care Forum as well, because there's an egg donation part on there, and you'll see the difference that egg donation makes.
Yeah.
Just by reading people's stories on there.
Yeah. Oh, I'm just. Has the connection dropped slightly? I'm just checking.
I think we're back.
Yeah, I think
we're back. Had a little circle. We're back.
We're back. Brilliant.
Yeah.
Well, yeah. I'll just summarise what Luke was saying. Join the forum. You can chat to others as well, and sort of get that as well. That's nice that you've got all those similar people, which is great. Have you guys got any other questions, Lisa and Julie, for Jacob, on his experience?
No, I think that was the main one for me. With what was your deciding factor, and what can we do to help donors get the right information really out there for helping people make that decision? So that was probably the key one for me. But it's great to hear that the egg bank is so user friendly and quite easy to use. I think people.
Yeah, it was so because we didn't know what to expect when we were given access. I thought, oh, it's going to be really complicated, but it wasn't. It was so easy to use.
Oh, well, that's really, really good. And is there anything sort of before we wrap up, I guess, Luke, that any advice you would give to anyone about starting their journey, or any important points that you think we should raise just for people's info?
I would just say anyone thinking of starting their journey, just pick up the phone, choose a clinic first, or if you've got an idea, pick up the phone and speak to someone on the phone, because that's where our journey started. And just from that phone call with the Nottingham team, we knew straight away that was the clinic for us, that care was going to be our path. So yeah,
yeah, definitely. Yeah,
I mean,
we do kind of like to pride ourselves on being able to just offer that support, you know, be at the end of the phone whenever, be at the end of an email whenever. And like we said, no question is, you know, too many or too out there. Just we like to get, you know, just
like we said earlier, it's we're that in between person, and we all right across the group, I think all of the donation teams, everyone that works within that, we do see it as being that person that kind of supports both sides and supports so the egg donor goes through her process, but also the people that are using the donor eggs, and starting from the very first questions, like Luke was saying, got these little things that you're thinking, oh, I just want to ask that, and how does that work, right the way through the process. And so, I mean, obviously when it's successful, it's absolutely wonderful. And if it's not successful, you're the person then that's there to support them afterwards. You know, to see where do we go from here, and you do create some really lovely bonds with the patients. because we do genuinely care about.
Yeah.
Yeah.
Oh,
I've always the title, it speaks for itself, like care. They do care.
oh, that's,
Yeah.
oh God, don't get emotional. Keep forgetting, but it is such a wonderful thing. Again, if you are considering donating, yeah, like Jacob said, please pick up the phone. You'll be doing an amazing thing. No questions silly. You know, and then for those recips, or people that are going to be having donor eggs potentially, or looking at that treatment method, that your donors are doing it for the right reason. Find out loads of information about them. It's a lot more personal than you probably think. It's not just characteristics, you know, and we want you to all to have families and be happy and have your dreams come true. So
Definitely.
you've got a lovely, amazing patient from one of our clinics, and you've got the teams here that you can see who genuinely do care. So I'm hoping that has come across this evening. Has anyone got any final things to say or comments? But I just want to say, obviously, a massive thank you to Luke for joining us as well, and Lisa and Julie for giving up your time this evening to speak to everybody that's joined. But have you got any final things that you want to say?
I'll just say thank you to everyone out there that has donated, thinking of donated, because you're changing lives and you don't even realise it.
Oh, that's so amazing. That's so lovely.
That's what I was just going to say, Luke. So lovely. Thank you.
Even considering it is special thing, isn't it? That these people do this amazing selfless act to help somebody else have a family is just amazing for us. Yeah,
it's so special to be a part of. So please just get in touch, everybody, and if you've got any other questions, I think we'll get it wrapped up and we'll go off for the evening. Send love to Nova from us, Luke.
Thank you.
And to I've forgotten her name, please remind me. It's
Jess.
Yes, that was it. I don't know how I've forgotten. Oh, you know when your mind just goes blank because I'm trying to wrap up. Well, send love to Jess as well.
We will do.
So lovely to see you. But please get in touch with us, guys. And we hope that you've enjoyed the event this evening.
Thank you.
Thanks a lot.
See you later, guys.
Bye.
Bye.
Bye. Bye.